It's the leading cancer killer in the United States for both men and women, lung cancer. More than 158,000 Americans are expected to die from lung cancer this year, but many survive. And today is a very special day to be talking about this. It's World Lung Cancer Day. Here to tell us why is Lysa Buonanna, a lung cancer survivor, and Richard Davis from the American Lung Association in Nevada. So first off, Lysa, tell me a little bit about what this day means to you.
As a lung cancer survivor, it's really great to have a holiday that actually recognizes this day. And it was actually created by a fellow survivor, Betsy Thompson, about 4 years ago. And it's to celebrate those that are, surviving lung cancer, to honor those that we've lost, and more importantly, to raise awareness about lung cancer.
Which is very important.
Yes.
So tell me, how did you find out, and how has your life changed since your diagnosis?
September will be 4 years since I've been diagnosed, and my only real symptom was having a back pain that just wouldn't go away. So by the time it was discovered, it had already spread to my bones. And since then, my life has taken a completely different direction. I began volunteering with the American Lung Association pretty quickly and getting involved with their events and fundraisers and programs that they have. And also through the Longevity Foundation, I do mentoring of other survivors, and I've been lucky enough to be able to start a lung cancer support group here in town too for survivors and their families as well.
That's awesome to hear.
Yeah.
Okay, Richard, let's go over to you. Let's talk about screening and prevention. What can people do?
Well, the best thing that someone can do is never smoke, or if they are a smoker, to stop now. Most early detection of lung cancer, people survive at 5 years at 54%, but unfortunately most lung cancers are not detected until advanced stages. We hope to change that at the American Lung Association by advocating for early detection of lung cancer through the use of low-dose CT scans, especially for high-risk groups. We see that that would be the best way to lower those high numbers of deaths due to lung cancer.
Okay, and Lysa, there's been a rise in lung cancer in women. What do you want people watching to know?
Most importantly, that anyone can get lung cancer. I was a healthy, active 40-year-old, and I recently just met a beautiful 20-year-old girl that just lost her life 2 weeks ago. So no one's immune to lung cancer. Like you said, it is the #1 cancer killer for both men and women, yet it's one of the least funded as far as medical research goes. And as Richard said, research is the key to finding earlier ways to detect this disease, to save more lives. And that's also why events that they have, like our upcoming walk in November, the Lung Force Walk, helps raise money that goes not only towards research, but all the other lung health programs in Nevada also.
So we talked about some sort of screenings and scans and things. Where can people go to get those done? How should people start this process?
Ask their doctor if it's right for them, and of course there's different centers in Las Vegas that are certified as low-dose CT scans centers, and people can go to those locations. Like Lysa was saying, smoking, of course, is the primary cause of lung cancer, but there's other significant causes such as radon exposure in the home. I used to think that was a back east issue with their basements and so forth, but through the University of Nevada Cooperative Extension's awareness program, we're becoming more aware of the dangers here in Nevada for radon exposure. Luckily, it's easily detected in the home through a simple test, and there's simple things you can do to reduce the levels of radon if they are high in your home.
That's all great information to know, and great information for the public to know. Thank you guys so much for taking the time out and coming, informing all of us. Yes. And we will be right back with more after this break.